As the pandemic wears on, there's an old threat claiming new lives here in Ohio.
Opioid overdose deaths hit a 10-year high in our state between April and June of last year, this after a 2-year decline. Now, several communities are sending alerts over spikes in overdoses and warning people they may not know what they're actually taking.
And tonight, our Bob Jones takes an in-depth look at the concerns in Stark County. He spoke to a woman who understands the struggles of addiction.
It became an everyday thing. No matter what I did or where I went, I had to have it.
Ashley Wood thinks back to when her addiction to cocaine started about 20 years ago.
It was a huge addiction that became habitual.
When she was in college on a full-ride softball scholarship.
By my senior year, I was so into them that I ended up quitting softball and dropping out of college my senior year.
Her struggle lasted until 2008, but Ashley has been sober for almost 13 years and now works as a peer support specialist for Stark County Task, helping others trying to overcome the grips of addiction.
I think the biggest part is helping another person, and that's what keeps it going.
Ashley is alarmed by a Canton City public health alert revealing 4 recent fatal overdose deaths over 5 days in Stark County, and OD visits to emergency rooms are also climbing. Julie Priebe, an addiction recovery nurse with ComQuest, is worried too.
No one wants to have to tell parents that their child died. The biggest loss we could have.
Stark County saw its highest number of fatal overdoses last year with 130, and Julie believes the pandemic is one reason the problem is persisting.
Just like everybody else with the pandemic, people are anxious, people are lonely.
And Ashley says many people may not realize what drugs may be laced with.
There's pressed pills out there now with things that we don't know what's in it. And obviously we're hearing that it's fentanyl.
Harm reduction strategies are critical when there are clusters of overdoses. Health officials say that includes not using alone, having Narcan available, and recognizing the signs of an overdose.
Discoloration, looking bluish, looking grayish around the lips and the mouth and the fingertips especially.
Julie and Ashley are both part of a quick response team that provides hygiene bags, Narcan, and resources to overdose survivors.
We try to talk to them about the risks and the dangers going on right now.
And Ashley, who is now playing softball again, believes letting people know there is hope and help is even more important.
Letting them know that sobriety is possible. You don't have to live in that struggle.
In Canton, Bob Jones, News 5.